Thank you.
The question is that the motion be agreed to, and I call the member for North Sydney.
Thank you, Deputy Speaker. Before I begin today, I just wanted to take a moment to encourage anyone who is triggered by anything I say from this point forward to please reach out to those you trust and love. Alternatively, to one of a number of excellent services who are there to support people experiencing mental distress. They include Kids Helpline on 1800 551 800, Lifeline on 131114, or Beyond Blue on 1300 22 4636. With that said then, I stand before you today as a passionate advocate for youth in Australia, and in particular for youth mental health. Throughout my career and since being elected to Parliament, trying to build greater support for vulnerable young Australians facing mental distress has been a primary focus for me. It devastates me that youth mental ill health in Australia has reached unprecedented levels, with the most recent ABS data showing that 2 out of 5 young Australians aged between 16 and 24 have experienced a mental health disorder in just the past year. Devastatingly, suicide remains the leading cause of death for young people in Australia. In this context then, the beginning of End Youth Suicide Week this week, today, provides us with an important opportunity to stop and reflect on what role those of us in this place can play in improving the circumstances of young people. This campaign, driven by a number of organisations, including the incredible team at Youth in Search, encourages our community and young people to defy the stigma associated with mental health and openly talk about suicide with their friends, families and communities. There are many factors that can bring someone to this position, including social isolation, relationship breakdown, trauma and even the rising cost of living. And while all of it is understandable, the loss of even one life due to it is unacceptable. Behind the numbers are real people, young Australians who have incredible futures ahead of them and deserve access to the support they need to live out their potential. And while this crisis unfolds, the health sector carries a growing burden as it awaits the fulfilment of a promise for system-wide mental health reform in Australia. Whilst I support talk by the government of reform and understand such reform takes time, immense resource and sensitivity to the issues, we need to start seeing roll out. The National Mental Health and Suicide Prevention Agreement outlines the shared intention of all governments to work in partnership to improve the mental health for all Australians, while the Vision 2030 blueprint for mental health and suicide prevention provides a blueprint for a successful, connected mental health and suicide prevention system to meet the needs of all Australians. Both of these strategies are welcome, but we desperately need to move beyond good intentions and towards tangible interventions that meet young people in the space they need to be met, by ensuring we know what services are needed, where and by whom, and then working to provide those services in a way that is infinitely accessible to all, regardless of where the person lives or their socioeconomic or cultural status or background. We can do better, and I call on the government to take tangible action today. I stress the urgency of the situation that is faced by the health sector in this waiting game. In 2022, of those diagnosed with a mental health disorder between 16 and 34, when more than 1 in 3 had not had their counselling needs met. In November last year, I questioned the government on their plans to cut its support for subsidised mental health sessions by half in 2023, and I continue to condemn the government's decision to move forward with that decision. Chronic mental health conditions need more than 10 quick appointments. We need a system that is mobilised around the individual's needs, rather than one that is curtailed by an arbitrary number. The previous government introduced 20 Medicare subsidised sessions available to young people, purposefully in response to the prevalence of mental ill health in the country. With the crisis only worsening, young people must be able to access the mental health service they need. I disagree with the government's independent evaluation of the Better Access Initiative to defend their decision to take away this mental health support from young Australians and continue to argue it's not justified. The urgency of the situation does not allow for the budget to be prioritised above the health and well-being of young Australians. Speaking with people at the coalface of this challenge across our community has shown me that we have the information and innovation needed to make the necessary long-term improvements to the mental health of young Australians. We just need the political will. It is time to prioritise the system-wide health reforms promised by the government to ensure our nation remains the best country in the world for all Australians. Thank you.